Alrighty, perfect.
Awesome. Well, yay, the menstrual cycle is amazing, very complicated. So I think what I'll do, if it's okay, is just kind of go through the general phases and what sort of a typical cycle looks like. And then, of course, there's so much variation, which is very normal. And maybe some of your questions will get into that as well. So we can always address that too. But basically, most folks experience a 28-day cycle. There's, again, a lot of variation there, but between 21 and 35 days is really kind of the big range that we see. Less than 1% of people experience, less than 21 days or more than 35. So usually we're looking at a 28-day cycle, and that's kind of the easiest way to think about the phases. So I think that's what I'll work with for this presentation. The first thing that happens is if you think about menstruation and the loss of blood and that kind of period time frame, that's technically the beginning of the cycle, which is kind of interesting, but it's easier to think about it if we kind of go right after that. So you've had your period, everything's out, you're starting over, and that is now into the follicular phase of the cycle. And what's happening now is that your body is preparing for pregnancy. Basically, the whole point of the cycle, which is important to recognize, is pregnancy, reproduction, conception, all of that. That's kind of our biological drive with the cycle. So at the beginning, we all have a finite amount of eggs in our bodies. We're born with about 1 million. And then by the time we hit puberty, about 200,000, give or take, are left. And so each month in the follicular phase, you have about 15 to 20 eggs that your body is like, okay, these are the eggs that we're going to try to get fertilized, basically. And so one egg becomes like the chosen egg during this follicular phase. And the way that happens is a bunch of hormones are released from your brain, and then follicular stimulating hormone, aptly named, is choosing one of these follicles or eggs to be the one that's produced during ovulation. And the way they kind of choose it is just based on how much estrogen you're producing. So at this point, the estrogen levels in your body are rising, and one egg is kind of the winner. It's producing a lot of estrogen, and so maybe that's the one that's chosen. And so during this follicular phase, it's developing, it's growing, it's producing the estrogen, and this is kind of that first 14-day window after your period. That's what's happening, and there's some variation in that time frame. So that's something where you might see different lengths of cycles. But generally, if we're going with the 28-day cycle, 14 days, your body's preparing that egg, trying to get it ready to be ovulated. And at this time, your estrogen levels are rising. So that causes your cervical mucus to become thinner because basically you're wanting to provide more easy access for sperm for fertilization. And so the mucus becomes thin to provide that passage. And some other body changes that happen with the estrogen levels. So then we head into the next 14-day phase. That egg is pretty ready. It's grown, it's developed, it's ready to be ovulated. Then we see a surge in something called the luteinizing hormone, and that's the luteal phase, which is the next 14 days of the cycle. And that is usually 14 days, like almost in every person, that there's a little variation in that phase. So 14 days from when your period comes, if you have a 28-day cycle, is when you might have ovulation pain. Which is called Mittelschmerz. And so sometimes people will feel kind of in the middle of the month, a little bit of cramping or pain. And it's like, what's happening? I'm not on my period. It can be from that. And at this point, the surge in this luteinizing hormone happens, and the egg is ovulated and released from the ovary into the fallopian tubes, where it's kind of ready, hanging out, waiting for sperm to be fertilized. And so if you don't have, if you're using contraception or you aren't sexually active or whatever, there's no fertilization. At this point, the follicle, where the egg came from, starts to decompensate, I guess, turns into a different cell called the corpus luteum, and then that produces progesterone. And the progesterone kind of comes in, it's a different hormone, causes different cervical changes, thickening of the mucus to protect and kind of keep any products of conception in the uterus, if that makes sense. It thickens the lining of the uterus to provide a healthy home for any implantation of an egg. And so you have a kind of growing and thickening of the uterine lining. And then if you don't have any implantation, there's no fertilized egg, then what happens is the progesterone drops. The levels drop. There's nothing for it to fertilize. There's nothing for your body to produce. And then you start having your period, and you just slough off all the lining of your endometrium. And that's what is coming out during your period, all the blood and the lining of your endometrium, because it wasn't needed for any kind of pregnancy, I guess. And then the cycle starts again. So it's more complicated than that. I'm sorry, that was like a really basic
Perfect.
overview, but there's some hormonal stuff going on, but I think hopefully that gives a good sense of it.
Yeah, perfect. Absolutely. And then just one question. So say you the egg does get fertilized. Does your progesterone levels still drop, or do they remain, or do they increase?
Yeah, that's a great question. Generally, it remains at a kind of a level because you have that thickening of the cervical mucus, which is a protective factor to try to keep pregnancy intact. And then you want to have the progesterone kind of steadily being produced so that you have the thickening lining of your uterus. And then what happens though is that it's not produced by that cell, the corpus luteum anymore. The placenta starts to develop for pregnancy, and then progesterone is produced by the placenta.
Oh, okay. Very cool.
Kind of interesting. That is a whole crazy organ, so that's the other thing.
That's amazing. Yeah. No, that's perfect. Thank you so much.
Yeah.
Yeah, so we'll just go into a few questions now that kind of get a little more specific. And so we'll just kind of switch off if that works for you. So yeah, just kind of for like basic cycle tracking, what are some kind of symptoms or characteristics that we can look for during certain portions of the cycle?
Yeah, I think that's a really great question. Cervical mucus, as I talked about, is definitely one of the ones that folks will track the most. And sometimes it's kind of an interesting process to figure out what's normal for your body and what that looks like. But I would always recommend, there are some really great apps for cycle tracking. And I use an iPhone, so I don't know, I have like the health app, which I think is really great, but there's also one called Spot On, which is really good. And there's one called Flow, FLO, that's really good. Anyway, but it can kind of give you a sense, if you're not really sure like what your body looks like or what it's doing, give yourself 1 month and kind of start looking at what's happening. And you can just track like, okay, this is maybe the baseline of my cervical mucus. It seems like pretty thin, kind of sticky. That's usually more of like the estrogen first 14 days of your cycle. Your body's trying to prepare, provide room for that egg or sperm to get through. And so, so that's like thin and sticky and clear-ish kind of, I would say. And then after you ovulate, so somewhere in that middle of cycle, 14 days or so, you'll start to have it be thicker, and then cloudier is kind of an interesting characteristic of it. And so if you kind of are tracking on that app, even like what it looks like, you can kind of see where you're at along there. And then one of the other things that happens is your body temperature rises with progesterone. And so people will track their body temperature, and that will also tell you kind of where you might be in your cycle. So some of these are natural fertility methods too, if you're trying to get pregnant or however. And if you have to do the body temperature though, it's first thing in the morning when you wake up, don't have anything to eat or drink, and just take your temperature right away. And you need a special thermometer that's like a basal body temperature thermometer that will give you a couple different digits. So instead of like 98.1, it gives you like 98.14. So it's really specific. And then if you usually it's the same thing every day, and if you start to see it rising, then you may be in the ovulation time period. So that's something to know too. But I think the apps are really important because that's kind of a way that you can learn yourself, because everyone's a little bit different with what they experience in these timeframes.
Yeah, absolutely. So the cervical mucus and the body temperature, and what would both of those, kind of mentioned with the cervical mucus, but the temperature, what would you see kind of in that luteal phase during your period and the other phases in the cycle?
Yeah, that's a great question. It's basically it rises with progesterone and ovulation. So you should be seeing for the first, follicular phase of your period and after menstruation, it should be pretty much the same. It should be whatever your baseline is, 98.14 or something. I was going to say, I don't know why I'm on that, but just all day, every day, that's what it should be. And then when you ovulate, the progesterone is released and it starts going up. So you'll see like 98.15, 98.16, and it just kind of keeps rising just on those little levels. And then it stays it'll stay up if you are pregnant. And that's one way that people will track and say, oh, like I'm excited, I think maybe you're pregnant if that's what you want, Yeah. And then if you're not pregnant, you don't have fertilization, then it starts to go back down to your baseline again after you have your period generally, or a few days before. Okay. Other things that happen sometimes, interestingly, like because biologically the point of the cycle is to get pregnant. And so you might see a rise in libido also about 2 to 3 days before ovulation, because your body is trying to signal like this is something that we want to get pregnant, like this is. So that's something that's interesting too, for a lot of people. Just something you can track as well, because these apps will track everything. It tracks mood, it tracks libido, it tracks all these kinds of things, hormonal levels and things, so you can just kind of see what's happening for you.
Absolutely. That's wonderful. Thank you.
Going off of that, I feel like cycle tracking is one of the best ways to kind of find out if you have any issues or irregular periods. Would you mind going into like what an irregular period is and like some things that could cause it?
Yeah, oh my gosh, totally. And that's such a common thing. And your period, the cycle length and all of that is all based on these hormones and how they're being produced. And sometimes you might have a lack of hormones from stress, from diet changes, from exercise, there's so many different things. So you could have typically a pretty normal cycle of whatever we were saying in that 21 to 35 day range, whatever's, normal for you. And then you might see a variation in that all of a sudden and be kind of like, what's happening? And it doesn't necessarily mean pregnancy or anything. It a lot of the times can just be from environmental changes. And especially for this environment, for school and school stress and college. And I mean, there's just probably, I would imagine, a lot of variation for people is being experienced. And that's, perfectly normal and physiologic. It's just sort of about what's happening in that first 14 days with the follicular growth and change and development of the egg. That's where we see whether that's happening or not, because you have to have those hormones released from your brain. And if you're having brain changes from stress or, different things going on in your life, it will slow down maybe that development of the follicles and then kind of stretch out that time period before the follicle's ready to be ovulated. And so that's why you might see some variation. People who have irregular cycles, from the sense of like, just generally, that's my baseline. Like I've never had a regular, for example, cycle, and I'm always kind of all over the place. I think that's something that's always good to be evaluated, here at health services or wherever, because sometimes we can look at thyroid levels. Thyroid dysfunction can cause sometimes irregular periods. There can be a lot of other kind of physiologic things going on, blood pressure, diabetes, so just any kind of chronic conditions also that will affect these hormone levels and cause variations. So sometimes it's good to get that checked out if it's something that's pretty consistent. But again, there's sort of the idea of being regularly irregular, if you will. And sometimes that's just normal for folks. And that's just the way that your body kind of manages this cycle. And it's okay. It's perfectly okay. It's just kind of about what's right for you.
Definitely. And then kind of a follow-up question to that. If for some reason somebody is concerned about like how strong their cramps are or like the flow, would you consider that to be like a cause for concern to kind of reach out to your healthcare professional?
Yeah, I mean, I think it always just depends on how it's affecting your life, So if you find that it's really debilitating with cramping, or you find that, the flow is just really horrible and it's happening pretty frequently for you, and, then of course, please reach out. There's always things we can do. With cramping, what happens is your uterus is contracting to be able to shed the lining and have menses. And so when it does that, it releases these hormone-like substances called prostaglandins, and those are really associated with pain, unfortunately. And so it's kind of just an offshoot of that process of contracting to get rid of the endometrium. So if you take ibuprofen or Motrin or things like that, that specific type of medication is actually a prostaglandin inhibitor. So the idea is that that is supposed to be really helpful for cramping, and that's Motrin and all the stuff that's kind of out there for menstrual cramps. That's why we recommend those medications over something like Tylenol or aspirin for pain. We really hit like the ibuprofen type class of medication, because that can help a lot. And it's fine to take that in higher doses, like, during that short period of your period. That's totally fine to do that. And I think I would recommend it if it's helping. And then in terms of the blood flow, that also has to do with estrogen levels a lot of the time. So if you have higher estrogen levels, and then you kind of build up that endometrium more than maybe other folks do, and then you just have more that's coming out, if that makes sense. And so that can be a hormonal thing that can usually be treated with hormonal birth control, or sometimes the IUDs. The hormonal IUDs will treat heavy flow if that's something that's concerning for folks. So there's a lot of options. But again, it just kind of depends on what you're willing to work with and how you feel.
Absolutely. Yeah, wonderful. And then just one more question for you. What are kind of some credible resources that you would suggest to people who want to continue to find out more information about their cycles? Yeah.
Sure. No, I really like a website called bedsider.org, and I can send this information out if you want, but they talk a lot about just like all things sexual reproductive health, and they have really evidence-based information, which is really helpful. They have really clear-cut resources as well, sort of charts and things that you can look at in terms of the menstrual cycle, what might be happening for you in terms of hormone levels. They talk a lot about birth control, and birth control doesn't have to be just for contraception, of course, reasons. It could be for heavy flow, like I said, it could be for acne, it could be for all other kind of hormonal offshoots that might be happening, or symptoms you might have that are bothering you during your period, So there's a lot of treatment options and things that are out there if you're interested. And then, of course, please always reach out, to us at University Health Services. I'm here, my wonderful colleagues are here, and we're all about this kind of stuff. So happy to talk to anyone about what's happening for you and what's normal and what's maybe concerning. And there's so many resources. So please reach out.
Absolutely. And just for people watching this in the future, what would be an easy way to reach out or to kind of set up an appointment with you all have concerns or just questions?
Sure. Yeah. We're pretty much a phone-based system right now. I think they're trying to work on it online scheduling, but it hasn't come about yet. So the phone number is 426-1459, and it's just the front desk here, and you can just make an appointment anytime. We're pretty open in terms of scheduling stuff. It's pretty easy to get in within a week or two to just talk about any options. And then, of course, you don't need to do anything. It's just we're just here to talk and figure out what's right. And maybe the answer is nothing. But if there is something that can help, then it's easy to explore.
Yeah, absolutely. Wonderful. Well, that is all the questions that we have for you. Is there anything else you want to mention before we kind of close things up?
Gosh, no, I mean, I am by no means an expert, so I would just like to say that. And if there are other questions or things that come up or anything that's not clear, please let me know. And I'm happy to try to clarify some things or find some other resources. And just happy to talk about this stuff all the time. And we're all still learning and trying to figure things out. So we're here for that exploration anytime. And thank you for asking me to do this. It was a pleasure.
Absolutely. Thank you so much for being with us.
you.
This is going to be amazing. So yeah.
Of course, keep me posted if anything else comes up.
Thank you so much.
Awesome.
Have a great rest of your day.
Bye. Bye.